My name is Anjanette Sorapuru, acute care nurse practitioner and DNP student. I am recording a virtual presentation on behalf of myself and my academic advisor, Dr. Loris Buzegard, DNP, acute care nurse practitioner. My quality improvement project is decreasing the rate of central line-associated bloodstream infections in the intensive care unit at a level 1 trauma center. Hospital-acquired infections are one of the top 10 causes of mortality in the United States, accounting for 1.7 million infections and 99,000 deaths. Central line-associated bloodstream infections, CLABSI, are the most common and costly infections, accounting for 14% of hospital-acquired infections. Healthcare-associated bloodstream infections account for an estimated $28 to $33 billion in healthcare costs annually. CLABSIs are associated with the healthcare cost of $37,000 to $39,000 each episode. CLABSIs occur up to 80,000 a year, with 28,000 deaths occurring in the ICU. The purpose of this project is to demonstrate that the use of a quality rounds checklist in an intensive care unit will decrease the rate of CLABSIs. Project goals is to decrease the rate of CLABSIs, to educate the ICU staff on a quality rounds checklist and ensure adherence and accountability, and to enhance communication among the interdisciplinary team. Methods. This study was approved by the Institutional Review Board from the University of South Alabama, and the requirement for written informed consent was waived. Institutional Review Board approval was not needed for Atlanta Medical Center. This study was conducted in all intensive care units at Atlanta Medical Center. Surveillance of CLABSIs was conducted by 3 trained infection preventionists using National Health Safety Network case definitions and device day measurement methods. Data was gathered retrospectively from January 2014 through December 2014, and post-implementation data was collected from January 1st, 2015 through May 31st, 2015. Interventions to reduce CLABSI rates included educating nursing staff on quality rounds checklist and implementing the quality rounds checklist. And this is the quality rounds checklist that was implemented. And this is the National Health Safety Network laboratory confirmed bloodstream infection definition that were utilized in this project. Results. During the pre-intervention period, there were 5,346 documented catheter days and 6 CLABSIs for an incident density of 1.12 CLABSIs per 1,000 catheter days. During the post-intervention period, there were 610 catheter days and 1 CLABSI for an incident density of 1.63 CLABSIs per 1,000 catheter days. As a result of early central venous catheter discontinuation, there was an overall 87% decrease in CLABSI days and 83% decrease in CLABSIs. Results continued. This graph shows the pre and post monthly incident density. And as you see, the first month had a 50% decrease from 1.79 to 0.90. The second month had a 78% incident density decrease from 1.28 to 1. The third month had a 1.4% increase from 1.68 to 2.5 incident density. The fourth month had a 100% increase from 0 to 1, and the last month had a 50% incident density increase from 0.85 to 1.70. Discussion and conclusion. Implementing a quality rounds checklist during the multidisciplinary rounds was associated with a decrease in CLABSIs during certain months. Initial success of this project was influenced by improved compliance secondary to consistent surveillance by infection control staff. The purpose of this project was not consistently met. However, continued success was dependent on adherence and accountability. Overall, there were little improvement in CLABSI rates. This project will be implemented once enough nursing staff, ICU nursing staff to be specific, infection prevention staff, and ICU administrative staff is employed. And this is my references. Thank you.